Hello and welcome to my presentation on congenital chromosomal birth defects. So an overview of these birth defects. Chromosomal defects are caused by too few or too many chromosomes or problems in the structure of the chromosomes. This disorder might be inherited or sporadic, and chromosomal abnormalities occur when a segment of the chromosome is deleted or duplicated, and these types of abnormalities can cause birth defects in one or more organ systems. Different types of disorders. One type is called a trisomy, and trisomy is a term used when 3 chromosomes are there instead of 2, instead of the normal pair of 2. So, for example, if a Down syndrome child has 3 copies of a chromosome instead of chromosome number 21 instead of the usual pair of 2, then this condition is called trisomy 21. Other common trisomies are trisomy 18, which is Edwards syndrome, and trisomy 13, which is Patau's syndrome. So Down syndrome. Trisomy 21 is when there's an extra copy of chromosome number 21, and we can find this out with the use of blood tests and ultrasounds early on in pregnancies. The risk of this is increased as the ages of the mother is increased. The features of Down syndrome include mental retardation, slow growth, abnormalities of the facial skull, and upward slanting eyes and a flattened face, as well as heart conditions. The major problem of this is overall developmental delay and limited cognitive ability. Physical therapy can help strengthen the muscles of babies with this condition and help them learn a little bit more easily. Because it's associated with chronic health problems, children with this must receive regular medical care. Support services are available for children with Down syndrome and for their families, and as they grow older, many of them can hold jobs and live independently, and people with Down syndrome can make lasting contributions to society. Edwards syndrome, otherwise known as trisomy 18, after the physician who found the disorder, affects approximately 1 in every 6,000 to 8,000 live births. These children have severe developmental delay as well as severe birth defects and health problems. 50% of babies born survive beyond their first 6 to 9 days, and about 12% of babies born survive their first year of life. It is difficult to predict their life expectancy if they do not have any immediate life-threatening problems. Babies with trisomy 18 have low birth weight, a weak cry, and they startle to sound, and they usually have problems feeding and fail to thrive. The problems with feeding and their heart problems give them an increased susceptibility to infection, and these are factors that contribute to the death of these children. Patau syndrome, or trisomy 13, named after the physician who found this disorder, affects 1 in every 8 to 12,000 live births, and 50% of babies born with trisomy 13 survive beyond their first week to 12 and a half days. About 20% are born survive their first year, and it is difficult again to predict their life expectancy if they do not have any immediate life-threatening problems. Usually, babies with trisomy 13 have normal birth weight, but have a small head, sloping forehead, large noses, low set and unusual shaped eyes, difficulties in breathing, cleft lip, and heart defects are very common. They're usually born with small areas of skin missing on their scalp, which resembles ulcers, and their brain usually has major structural problems and often doesn't divide properly into the 2 hemispheres. They also have extra fingers and toes. So the rates, overall, chromosomal defects account for only about 6% of all birth defects, but for trisomy 21, it is directly linked to the woman's age. So if a woman is 25, the risk is 1 in every 1,300. When she becomes 45, the risk is 1 in 30. The trisomy 18, this is more rare abnormality, and it occurs in 1 in every 2,500 births in the US. When you account for the stillbirths, it becomes 1 in every 6,000. Trisomy 13 is very rare, and this abnormality affects approximately 1 in every 8 to 12,000 live births. This has been my presentation on birth defects. Here are my references. I hope you have found this informative, and thank you for listening.